Hello, I'm Doug Apple, back with another special interview for you today. And we're going to be talking about this headline on NPR's website, or you might have heard it on the radio. And here's the headline: Americans are furious over healthcare. And then I'm going to share with you a couple of quotes from this article. It says, the fury over the state of U.S. healthcare isn't going away. And one of the things that brings this topic to the forefront is that it's been a few days now since United Healthcare CEO Brian Thompson was shot and killed in Manhattan. And this article says that shocking targeted killing has also sparked a reckoning over the business he ran in a country that has, quote, the most expensive healthcare in the world. Thompson led the largest U.S. health insurer, part of a massive for-profit conglomerate. The article goes and quotes one protester who said, we're facing an apocalyptic moment in human history where hundreds of thousands of Americans are going bankrupt because of medical bills, and the executive suites of these private health insurance companies are laughing all the way to the bank. The article quotes another woman who said, people are feeling powerless. The article says this: consumers' sense of powerlessness is often amplified when dealing with health insurance companies, which govern the care that patients receive. But navigating those huge and opaque companies can be maddening at best. And I'll finish with one quote from a man who said, the insurance companies are out of control. They need to be broken up. Well, we're on the phone line with our favorite commentator on all things healthcare, health insurance, and in his case, nonprofit healthcare sharing Christian ministries. We have Mike Sharman. He's the legal counsel for Share Healthcare, which you can find out more about at sharehealthcare.com. But Mike, this the sad murder of this healthcare CEO, Brian Thompson, has really brought this thing to a boiling point, as this NPR article points out. I know you have a lot of thoughts about what is said in this article and what people are saying and how this is really blown up since this murder took place. So what do you think about it, Mike Sharman?
Well, thank you, Doug, for bringing this to our attention and doing it so that we can talk about it in a Christ-centered way. And I think it's important to recognize who some of these speakers are. As you mentioned, Sam Beard said we're facing an apocalyptic moment in human history. Well, he's one of the guys that's trying to raise money for the murderer's legal defense. In other words, he supported the murder of CEOs. So it isn't apocalyptic. The apocalypse happens when God wants it to happen. What this is an indication of the truth of what we've said so many different times. Big is bad. When entities get too large, they remove themselves from the consumers by too much distance, and they begin to be totally profit-oriented as opposed to, well, how can we help our customers so we can keep them, et cetera. So one of the positive things in this article is mentions that Republican Senator Josh Hawley of Missouri has introduced legislation that would break up the healthcare conglomerate. Now, they're not merely insurers, they're conglomerates. And the quote from him is saying these insurance companies are out of control. I think you had mentioned this. Mm-hmm. They need to be broken up. And here's the point about big is bad. No more buying up doctors' practices. No more owning pharmacies. Start putting patients first. And so we've had legislation that's allowed pharmacies, in some ways, to get into healthcare to get into pharmacies. Pharmacies getting into insurance in a lot of different ways, insurers getting into pharmacies and buying up the doctor practice, trying to have a true vertical and horizontal monopoly or oligarchy over this. Big is bad. We need to be able to have everybody stay in their own lane, and things would stay much more affordable. But I think and even much larger, that's kind of getting into the details, really, as opposed to the larger issue. The larger issue is a contempt for other people. Luigi Mangione had contempt for the life of the CEO, Thompson, that he killed. He had contempt for his family members. He had contempt for his friends. So, again, Mangione had contempt for his own family and look at the grief that they're going through. We really need to be able to have tattooed on the inside of our forehead the basic Christian principle of think of others more highly than yourself. Mm-hmm. And if the insurers are doing that, then we're going to be better off. If the pharmacies are doing that, we're going to be better off. If the pharmaceutical companies are doing that, we're going to be better off. If these protesters would really decide to get really, truly radical and think of others more highly than themselves, we would be better off. And the idea, too, of healthcare sharing ministries. Share Healthcare is a healthcare sharing ministry. The 501c3, not-for-profit Christian healthcare sharing ministries. The basic premise is, let us help you with your burden, and we're doing that because we're brothers and sisters in Christ. You can carry the load that you can. Whatever, for Share Healthcare, that load we've sort of arbitrarily almost determined to be $1,000 per event, which is per diagnostic course of treatment. And then the rest is shared. And for us, it's $149 per month for a single, $249 for a couple, $349 for a family of four, and then $50 for each person after that. So that's how we try to deal with the Christian principle of you're supposed to carry your own load, but we're supposed to help you carry your burden. The Christian principle of think of others more highly than yourselves. We're focused on what can we do to help those Christians who are having these medical problems deal with them. What can we do to help these Christian families that want to be having health care provision once again be a small part of their budget as opposed to the driving issue in their budget? This should be just a fraction of their income. It shouldn't be as big as their mortgage or in many cases larger than their mortgage. And having it be a not-for-profit is really important. I mean, this is not a communist thing where we're confiscating your money and saying everybody has to be equal. No, this is us banding together as Christ had asked it to be united so that the world will see, these Christians, how they love one another. That's the basic premise. And when we look beyond this rabble-rousing, really, and anarchy, vigilante, I hear a number of people saying vigilantes, and this is beyond vigilantism. Mm-hmm. This is pure anarchy where everybody decides for themselves who they want to kill. One other part of this article was that there's being wanted posters being printed of other insurer CEOs. That's not vigilantism. That's encouraging people to go out and make a law unto themselves.
Really?
Yep. And decide who ought to live and who ought not because of what they think is justice.
Because running an insurance company is not a crime.
Well, it can be, but let's let the law take care of that.
Right.
If it's a monopoly, okay, let's deal with it on the antitrust way. If they've done fraud, let's let each of the attorney generals in the various states deal with that. And, I say attorney generals, but let's say we have a good Christian prosecutor in some county. Well, he can do a criminal case against an insurance company on behalf of one of his citizens in his county if he thinks the elements of the crime are there. We have no shortage of ways to deal with the wrong that's being done if there is wrong being done in insurance companies. But, a whole lot of insurance companies, they're stuck with a lot of the things they have to do. For example, they're having to pay for transgender care, which is transgender destruction. They're having to pay for contraceptives, which is another, earlier. Well, whether they do want to do that or not, we just go around the whole thing. By we, I mean Share Healthcare. We just go around all of that regulation that says you got to do this, you got to do that. We are for financial freedom, medical freedom, religious freedom, and we're allowed to do it legally because we're not insurance. We don't have the indications of insurance, let's say. We're more in the line of passing the plate across the nation and across denominations. You might think of us as a co-op, people banding together for their mutual interest. Co-ops pretty much started with 4 farmers who were adjoining thought, well, each of us can't afford a harvester just on our own. Let's buy one ourselves, and then sort of went on from there. The shipping costs that they tried to do with farming co-ops as well. Well, that's just what we're doing with Share Healthcare. But it also lets people choose what doctor they want to go to. It lets the doctors choose what they're going to do. The article that you put forward there, Doug, mentions that Dr. Diana Guernita, who's a rheumatologist, helps with people who have arthritis, et cetera, in California, which is highly restrictive and all sorts of regulated. It says after years of fighting with insurance companies, Guernita started a direct care practice that bypasses insurance and offers her services to patients for often lower fees. So a lot of doctors are doing that. They don't like the hassle that they're getting any more than their patients do. So they've gone to a direct care practice. Some are subscriptions, some are, pay-as-you-go type ones. But all of them are less expensive than what the insurers are having to pay because the doctors aren't having to have all that bureaucracy. And so those are the type things that we as consumers, we as individual doctors, we as individual Christians, what we can do to completely change the landscape is go around the whole insurance issue. Just go around. We do want to have the Josh Hawleys of the world, of our legislature, national legislature and state legislatures, dealing with what they can deal with to help break up insurance back down to manageable levels. And that's appropriate. But in the meantime, we can just go around the whole issue and keep in mind the overriding principles of, well, can we just do the 10 Commandments? That is kind of hard, but can we at least strive to do that as opposed to just decide we're just going to blow off all of them?
Well, I think of this phrase from that article that navigating these health insurance companies can be maddening at best. And listeners, if you feel like dealing with your health insurance has been maddening, then you might be thinking that the Christian ministry Share Healthcare might be just for you and your family, a breath of fresh air instead of madness. Well, you can find out more information on their website, sharehealthcare.com, or you can just give them a call at 1-844-SHARE-HC and find out the vast difference between what's happening in the health insurance world, where they're getting ready to have full-scale rebellion because it's driving people crazy and bankrupt, versus Christians coming together to help one another in this nonprofit Christian healthcare sharing ministry, Share Healthcare. And for Wave 94, I'm Doug Apple.